Thank you so much. Yeah, so my name is Julia Derk, and I am in biomedical science now. And so one of the major interests that I've been thinking about is not just trying to take the human capabilities where you two are so talented, and you talked about using these drones to expand your human capability and push it forward, but some people aren't as mobile as us. And in fact, some people are living in a vegetative state. And one of the major questions is whether they were conscious or not. Because for a very long time, we've had people go into these vegetative states after traumatic brain injuries or some sort of other external force a lot of the times, but sometimes internal forces too, such as stroke can put somebody into that. And then we don't know that they're alive or like conscious or not, and then they've come back before to us. And they've told us things about their experiences, and it's changed the way that we care for our patient populations. And I think that it's really important to think about the idea that you might not be able to perceive that somebody's understanding things from you, but really they are. And so the tool that I want to talk about today, most of all, is the Fmri. So Fmri stands for Functional Magnetic Resonance Imaging, and it's based on the concept that your brain needs oxygen in order to have neurons be firing. So as your neurons are firing, there's going to be disproportionate amounts of blood flow to that specific area. And as the oxygen comes from your blood into the neuron, it's going to emit a signal that we can pick up on this machine. So when somebody's in a vegetative state, without moving at all, we can put them into here and we can see what's happening to their brain. And what's been really amazing is that we've been able to use this in order to ask people questions. So what I want everybody to do is take a little interactive component with me for a second. And I want everybody to close your eyes and stay completely still. And I want you to picture yourself playing tennis. So picture yourself hitting the ball, maybe serving. Maybe you have tons of experience doing this. Maybe you've never done this before. Okay, so you're playing tennis. Okay, now stop. And I want you to keep your eyes closed, and I want you to picture your childhood home and walking around your childhood home and maybe seeing artwork on the walls, seeing the ways that the hallways were moving, something like that. Okay, now open your eyes. So when people are picturing playing tennis, without even moving your body, you are planning those motor coordination movements. And you're doing it so in the supplementary motor cortex of your brain. And so while you all were picturing playing tennis, regardless of if you were good or not, you are going to be having these signals coming up in this area of your brain. And this is happening all the time for patients that are in vegetative states that are being given this command, as well as normal control people that are out there in the world that are able to communicate with their words. Now, when you're doing a spatial navigation task, completely different areas of your brain are going to be lighting up. So here we have the Parahippocampal Gyrus. So if you've ever heard of the hippocampus, people like taxi drivers and stuff have very expanded hippocampi because it's all about the spatial navigation. And then your parietal lobe is planning this, and then the premotor cortex too, because you're picturing the movement of walking and all of that. And so the major point here, regardless of the anatomy, is that it's different locations, but that the average American person understands what tennis is and grew up somewhere, and they know how to navigate that space. So what they did was they asked people questions where if the answer was yes, they pictured walking or they pictured playing tennis. And if the answer was no, they would picture walking around their home. So you could ask me questions like, is your name David? And I'd picture walking around my home. No. Is your name Julia? Yes. Is your birthday March 5th, 1990? Yes. So I'd be picturing playing tennis, picturing playing tennis, picturing playing tennis. And they asked people questions, and they found that at least 20% of people that are in a vegetative state were able to do this task. And the amazing thing about that is that maybe some people don't know what tennis is. Maybe some people had some sort of issue in their hearing areas, but they could feel touch. Maybe there's so many reasons as to why people could still be awake and alive and conscious in there, but we wouldn't have known if through this specific task. So what they did was they took, for this specific paper, is they took 12 patients and 12 controls, and they showed that of the people that were able to do this task, there was exactly the same accuracy and exactly the same capacity to do it, and the blood flow to that areas was maintained. And from this original study 13 years ago, 2 of the people have woken up since, and they've been able to say what their experiences were like. And I think the most amazing thing, and there's a book that describes this in depth, it's by Dr. Adrian Owen, it's called Into the Gray Zone, is that they asked every person that they could get in contact with if they still wanted to live. And every single person said yes. And every single person said that they were happy. And the people around them were able to know that they were communicating with this person, whether or not they were in the Fmri anymore, because they were able to say to them, I love you, I'm here with you, etc. And when they did so, the people were much more likely to come back alive. So I think, taken in context with all of this, in the same way that when people are in a vegetative state, they're really in there, I think all the time we navigate the world, and people have different social cues, people have different languages, people have different ways of communicating things. And kind of going towards the socialization rules of inviting people back in, it's so much better for everybody if we can just invite people back in and we can kind of help their health happen. And so don't think that just because you're not getting cues back from people that they're not in there, because really they might be.